How's it going, guys? We have a difficult question for micro/heme for step one, 6-year-old boy. Today history, blood in his stool, and he's got reduced hemoglobin, elevated serum LDH, thrombocytopenia. We're handing you the diagnosis of hemolytic uremic syndrome, okay? We're not trying to make that part hard. Okay, so hemolytic uremic syndrome is when you have either Shigella liberating Shiga toxin or EHEC, E. coli, O157H7 liberating Shiga-like toxin, and you're going to have that toxin cause damage to the afferent arterioles going to the kidney. The platelets are going to plug that damage in the microvasculature, consuming the platelets, thrombocytopenia. They'll also jut out into the lumina of the microvasculature, shearing the RBCs flying past, which is why we get these schistocytes, aka helmet cells. The combination of thrombocytopenia and schistocytosis is called MAHA, microangiopathic hemolytic anemia. And so if you take thrombocytopenia and schistocytes, and then you add renal issues on top of it, can be hematuria, can be creatinine or renin elevation, which I didn't mention here. Maybe 4 out of 5 times they'll give you all 3, but they don't have to. That's going to be hemolytic uremic syndrome. Elevated serum LDH just means hemolysis. You'll see this in questions. It's high yield, okay? So for example, tangentially, maybe G6PD deficiency, you get jaundice and increased LDH. You're like, why is the LDH high? It's just hemolysis, okay? So the difficult part is OMG. We're talking about toxins, though, not actual HUS per se. But let's just whip through the answer choices. So choice A, inhibition of elongation factor 2, wrong fucking answer. This is going to be diphtheria toxin as well as Pseudomonas. Okay, I mean, I don't really know what to tell you. It can be a lengthy discussion. They give you a kid who's got a sore throat, gray pseudomembrane, myocarditis, very buzzy for diphtheria. Let's say he's unvaccinated, he's immigrant status, and the answer could just be inhibition of translation. That's it, okay, because elongation factor 2 is required for translation. Choice A, wrong fucking answer. Choice B, inhibition presynaptic snare, wrong fucking answer. This is going to be botulin toxin as well as tetanus toxin. Botulin toxin will cause, by inhibiting presynaptic snare, will prevent the release of presynaptic acetylcholine, causing flaccid paralysis. Tetanus will prevent the presynaptic release of GABA and glycine, causing spastic paralysis. Choice B, wrong fucking answer. Choice C, inhibition 6-DS ribosomal subunit, correct answer. Don't really know what to say. Okay, so this is what both Shiga-like toxin of EHEC and Shiga toxin do. And similar to choice A, the answer can just be inhibition of translation, okay, protein synthesis. So DNA to RNA is transcription, RNA to protein is called translation. So we're inhibiting the synthesis of protein. 6DS is a ribosomal subunit in eukaryotes only. So 60 and 40 are eukaryotes, 30 and 50 are prokaryotes. Let's just hop to finalized choices. Poly-D-glutamic acid capsule, wrong fucking answer. It's going to be Bacillus anthracis. Okay, so anthrax can live on the dry herds of goats. It's also known as wool sorter disease. Okay, it's the only bacterium, at least relevant for USMLE, that has a protein capsule. Other bacteria, Strep pneumo, Neisseria meningitis, Moths influenza type B, the ones required for vaccination when you have asplenia, sickle cell, or surgical splenectomy. Those are polysaccharide capsules. Wrong fucking answer. Choice E. Actually, real quick, I'll just mention that you can get anthrax producing edema factor. Okay, so they can say there's an S scar on the skin. They'll say black S scar with surrounding edema. That's cutaneous anthrax. If it's pulmonary anthrax, they'll get hemorrhagic mediastinitis. As I already said, wrong fucking answer. Choice C, production phospholipase, aka lecthinase, wrong fucking answer. Refers to Clostridium perfringens, gas gangrene. Okay, so necrotizing fasciitis, they give you subcutaneous crepitus, okay, or subcutaneous emphysema with any type of skin infection. They'll say there's black skin, And there's crunching, crackling, that's subcutaneous emphysema. It's CO2 and hydrogen gas produced under the skin. Very high yield. And they like phospholipase lecithinase. It's a weird factoid. It can show up. You can get emphysematous cholecystitis, okay, air in the gallbladder wall. Let's say there was prior iatrogenic intervention with surgery, and now you've got emphysematous cholecystitis. That can be Clostridium perfringens. C. perfringens can also be watery diarrhea. Choice E, wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.